Today we'll be chatting with Brian Lau, who will be teaching a specialty class during our conference this year. Brian, thank you for talking with us today. This year, during the Fsoma Acupuncture and Asian Medicine Conference, you'll be teaching on treating the Quadratus Lumborum and its associated channel Sinews. Can you tell us what inspired you and led you to create this class?
Sure. Thanks for having me. First of all, I decided to pick a subject, which I often do when I'm presenting at conferences like this, that is adequate for a 3-hour class and something that, isn't overly ambitious for the amount of time. You know, sometimes I go to conferences and I hear a topic that kind of covers a whole system. You know, we have in sports medicine acupuncture, we're presenting a system. That system takes a long time to learn. And, you know, it could be, I could have maybe gone over the system of sports medicine acupuncture and how we do things. To me, that seems a little bit like a commercial for the program, which I guess serves the program well. But when you walk away from it, you might not have as much to immediately put into practice because you kind of get the message like, oh, you have to come to the program to get this part. You have to come to the program to get this part. It is nice. And I think there's value in that for people who are looking, especially new in their practice, looking for some system that resonates with them and some body of work that resonates with them and allows them to kind of sample and say, oh, I really like what Brian Lau said. I really liked what this other person said. Maybe I'll check it out and explore that a little bit further. So I do think there's value in that. But personally, I wanted to pick something that was we could go into in depth in 3 hours. You could take that information regardless of what system you already use, and you can have a deeper understanding of that to be able to apply it a little bit more directly into the work you already do. So maybe I'll give a quick example. I have a structural integration background, which is kind of like Rolfing. And there's a educator I like quite a bit, Till Luca. And he teaches at the Rolf Institute. That's a system. You know, you have to take time to learn that system, but he also has classes where he teaches much of those individual techniques, not under the auspices of Rolfing, but just for anybody. You know, you can be an acupuncturist. I've known some acupuncturists who've taken his classes, a massage therapist, a PT, whatever. You can take that information, those techniques, which are great techniques that he's teaching, and apply them into the system, into the body of work that you already do. So that's the approach I'm taking for this class for the conference coming up with Fsoma.
Very interesting. And what is the clinical application of this class?
Sure. So clinical applications could be varied. The number one, the most obvious clinical application would be for low back pain. The Quadratus Lumborum is such a pivotal role in low back, especially for support. And we'll go over this a little bit more in the class. But if you look at the muscle, even just in an anatomy text, but if you look at the research in particular, it's kind of questionable about what the Quadratus Lumborum does in terms of its actions. It's not really in a good mechanical advantage to pull on the 12th rib, which is where it attaches. It's not in a really good mechanical advantage to lift the ilium where it attaches. It doesn't really do rotation or extension so much. I mean, it probably has a little bit of a role in all of those, but it's not mechanically very active in a lot of different movements, but a lot of things attached to it. So it kind of serves as a kind of an attachment site almost for other muscles to be able to transmit their forces and help integrate their forces from the abdominal muscles to the erector spinae to a whole bunch of structures. It kind of serves as almost a pivot point, you know, to help them do their role. So having good health in that muscle is going to have tremendous implications for the low back. So low back pain would be number one. But and then it has referrals patterns that tend to refer down into the hip and leg, so it can go into dysfunction with other muscles like the gluteus medius and minimus, and it can kind of travel down the leg. Sometimes the lateral quadriceps go into dysfunction with it. So it can be kind of a it can kind of play ball in a dysfunctional way with a whole lot of other structures. So sometimes those applications might be pain down in the legs or some kind of dysfunction with the lateral quadriceps, or due to its supporting and balancing role of the hip, maybe it has some implications for neck pain, because if you balance and kind of free the pelvis and get a better movement and better position of the pelvis, well, that's going to translate into what happens in the other girdle the shoulder girdle. So maybe that chronic neck pain has a component of QL, not causing the pain, but part of the imbalance and part of the movement and positional problems that are manifesting in the neck. So number one application would be low back pain. It's a key structure, very involved in many low back pain problems, but hip pain, sometimes dysfunction in the legs, neck, rib cage, breathing, because it has a very close relationship to the diaphragm. Many things, back pain, number one.
Wow, very detailed. That's amazing. What are the benefits of taking your class?
So this will be really learning how to understand the pain patterns that are associated with the Quadratus lumborum. The other thing, and this is back to a system approach, which again is a great thing, but for 3 hours learning a system doesn't really work. But you might learn a system and that system leads you to work with the Quadratus lumborum. But if you don't have effective technique on the Quadratus lumborum, then maybe you don't understand. It's like, oh, when I try to apply these steps in the system, I haven't gotten the same results as what we learned in class. Maybe it's just you need a little refresher on working with the Quadratus lumborum, and it's unrealistic when you look at the complexity of anatomy. And I'll talk about this in the conference. I've done a lot of dissection, so I realize why it's so hard because the body's so complex. I realize why it's so hard. Sometimes, even if you're taking a very detailed program, to be able to have a mastery of things, you have to spend a lifetime doing it. So it's nice to, even if you have a good familiarity with something like the Quadratus lumborum, to be able to hear it a different way, to have it presented a different way, and realize, oh, maybe I've been off on that muscle. It's just another chance to explore it. If you haven't worked with it much, which a lot of acupuncturists haven't, because it requires a little deeper needling, usually a 3-inch needle to effectively reach it. That's going to depend on the person. So maybe a lot of acupuncturists haven't taken that time to learn that deep needling approach on it. So being able to apply that effectively is number one. So we have to kind of explore the anatomy, look at the layers, look at the relationships, but then have some understanding of when to work with it, what else to work with at the same time, because how it forms so many relationships with other structures. So it's just a chance to take time and really dive deeply into this one structure, which I could present in 5 minutes, but to really do it justice, because it's such a key pivotal role, we need to take more time, and then hopefully walk away with that, with a feeling that you have a pretty good understanding of that region of the body, Quadratus lumborum in particular, but also its relationships.
And can you share with us, Brian, your professional history?
Yeah, sure. So in terms of this type of work, I got my start, I guess I could say I got my start really in my Tai Chi and Qigong practice, which I started in 1998. I've always been kind of interested in health and movement, and there were some other interests I had then that like I considered becoming a massage therapist. I was in college at the time, so it seemed like maybe not something to switch out of right away from that. So I finished my college degree, but then I got into Tai Chi and Qigong, and that kind of reopened my enthusiasm for this type of work. Initially, I went to school to become a massage therapist, because with my Tai Chi practice, I was really interested, which was very new at this time, with anatomy trains, which many of the acupuncturists know. That's a body of work that comes from Tom Myers, Rolfing, and structural integration, but he looks at these myofascial planes that look very much like the sinew channel. So that book had just come out, and I was really interested in what he had to say, because it matched some of the descriptions of what we call the sinews in Tai Chi and Qigong. We talk about these tendons or sinews that would travel up the back of the leg and through the back, and it's like, well, that's not a Western tendon. What is it? And this kind of explained. It explained that these were these myofascial structures, that myofascial planes of tissue. So that interest led me to become a massage therapist, and I went into structural integration, which was the body of work that Tom Myers taught, and he was a big influence on me pretty early on. So that's the body of work that I did for a while, and then I don't know, as I got more interested in fascial research, as that was really coming up the ranks in terms of the fascial research conference, and a lot more emphasis on fascia, which nobody ever talked about before, but all of a sudden there's a bunch of interest and a bunch of discussion on it. Part of the discussion with that was the body of work I was doing, structural integration, but also acupuncture played a big key role with that. Helene Langevin was a big figure in discussing kind of acupuncture through more of a fascial regulating approach. So that got me interested in acupuncture. Eventually, I went back to school for Chinese medicine and acupuncture, and then finished that. Eventually, after going in that direction, that's when I hooked up with Matt Callison and took the program through him, sports medicine, acupuncture. It was it had a lot of similar themes to the structural integration, so that appealed to me. When I finished that, he approached me and asked if I would teach with the program. So I've been teaching with AcuSport Education, sports medicine acupuncture certification since 2014, I believe. So in that process, I helped develop a class on the channel Sinews. That's kind of been the common theme throughout much of my career is the channel Sinews or these myofascial planes. I've been doing a lot of dissection since that time, including with the University of Tampa with the physician assistant program. I get to do that every year for their physician assistant program. So that's a great opportunity. We do a lot of dissection in the sports medicine acupuncture certification program also. So really trying to get a better understanding of the channel sinews, channels from a more anatomical perspective has been probably my biggest theme that I've been working on, especially really the last 20 years or so.
Amazing. And could you share with us a case where you had the best success using the knowledge that you'll be sharing during your class?
Sure. I will give that question a little bit of a caveat that we're going to be going into depth on the Quadratus lumborum, but we will be looking at relationships. So to be able to get results with that, first of all, if you know how to effectively needle the Quadratus lumborum, you'll get results. Sometimes you'll get amazing results because maybe that's just where the problem is and not really so much of anything else. And I'll give a case about that in a second. But more frequently, it's about combining it with other structures and being able to understand those relationships. So it's a little different class in that I'm not teaching. Let's say if I was teaching a class on low back pain, which would take more than 3 hours because you have to assess all these different problems and be able to differentiate between sacroiliac joint dysfunction and facet and a whole bunch of stuff. In that case, then you'd have to apply much more of a complex approach that'd be a little hard for 3 hours. So that's a caveat with that question is this is not just like put a needle in one place, everything's fine. But one case that comes to mind with that, and I've had this happen a number of times, but this one in particular, I was working with somebody with low back pain, a history of low back pain, but it had flared up and was very acute for a week. Difficulty walking into the treatment, getting on the table was difficult, getting in the right position. Just pretty much any movement, especially turning type movements, very, very painful. Antalgic gait, all of that. Through assessment, didn't seem, straight leg raise and slump test. Slump test was a little painful, but I think it was just the position. But it didn't seem to be a radicular problem. And then I started going to work, trying to differentiate and working with it. And in this case, I missed the QL as being the problem. And I'd work maybe slight results. And but it just didn't seem to really be helping the person. Got off the table. They were still in a lot of pain. And it just dawned on me that, I needed to work with the QL, needled that, got a couple fasciculations, and it was just like a switch turned off for the person. They were able to get up. The pain went away. It just was the right thing at the right time. So it's one of those structures that can produce amazing results when you needle it, when it's really the key problem. But more often than not, it's in dysfunction with multiple structures, and it needs to be worked on with those multiple structures.
Very cool. And well, I think that's it. That's all our questions for today, actually. Thank you, Brian, for sharing your time and knowledge with us today. I kind of wanted to see if I had more questions to ask because
Oh.
You answered them all so wonderfully. I'm like so into this right now.
Oh, well,
Okay.
thank you. Yeah, I'm looking forward to definitely looking forward to the conference. It's fun to dive into the anatomy. Anatomy is really, I think all of us have multiple hats, but an anatomist is one of my main hats. And I feel like with acupuncture, we learn this wonderful channel system that's so complex, but I don't think we learn it enough from an anatomical standpoint. So sometimes it can seem kind of baffling and confusing. It's like, I want to understand this better, but I'm just seeing these lines drawn over an illustration of a body, and where's the depth? Where does that line go? What level and layer is it on? So I think as our profession grows, we're going to have to really have a much deeper anatomical sense. And I will say really something about that real briefly is that's the case. A lot of people are going in our profession in a more anatomical approach, but sometimes they do that by throwing away some of the heart of Chinese medicine, the channel system, some of really what gives Chinese medicine its strength, because we don't teach it from an anatomical standpoint. So it's like, oh, okay, all of a sudden I'm going to put that to the side and I need to work with the Quadratus Lumborum and the erector spinae and the lateral raphe and all these Western terms. So really my passion, I guess, is to have those two integrated so that we can dive in deeply to the channels from an anatomical standpoint, but still be able to draw back and put it into a Chinese medical protocol and really keep the heart of the medicine there. So that's my passion, and that's what I hope to be able to share at the conference coming up.
That's beautiful. Thank you for saying that, Brian. So as a reminder for everyone, Brian Lau will be teaching on Sunday, August 27th at 9 a.m. This class is being offered live in person in Fort Lauderdale Beach, Florida, and it falls under the CEU category of biomedicine for a total of 3 CEU credits. Thank you again, Brian, for chatting with us today, and we will see you all at conference.
Great. Thank you. My pleasure.